Hello, I'm Clara White, and the purpose of this video is to provide direction in an ethical decision-making process using the moral model. The situation begins with a patient who was admitted for a surgical repair of a hernia. The operation was performed and the patient returned to the floor without obvious complications. A few days after surgery, the patient began to develop signs and symptoms of infection, which were noted by fever, chills, and poor wound healing. In investigating the situation, it was found that a sponge had been left in the patient in the operating room. Postoperatively, wound infection has an enormous impact on patients' quality of life and contributes substantially to financial cost of the patient care that ranges from increased pain and care of an open wound to sepsis and even death. Using the moral model, we shall begin with M, managing the dilemma. Postoperatively, the patient's incision would not heal. The circulating nurse failed to perform the adequate amount of sponge counts necessary during the surgery. Next, we will outline the options. Option A, provide a standard quality of care for the surgical patient by performing an adequate number of sponge counts necessary. Option B, omit standard of care established by hospital policies and procedures. Resolving the dilemma. For this operation in question, less than 1 dozen of sponges were required. It was standard policy and procedure for 3 sponge counts to be performed during the operation. Anytime there is a discrepancy, the surgeon is to be notified immediately. Upon notification, it is the surgeon's duty to the patient to resolve the discrepancy to the best of their ability. In cases where there is an incorrect sponge count, wound closure must not be completed until the missing sponge is accounted for, unless the patient is unstable. If after appropriate steps have been taken to find the missing sponge and it is unsuccessful, every detail of the search should be documented and the surgery completed. Acting by applying the correct choice. Option A was the best choice. The nurse should maintain a standard of care at all times. The circulating nurse counts the unused sponges and notes on a form that sponges were counted. When the surgery is complete, the nurse does a second count by combining the number of used sponges with the number of sponges that have been removed from the patient. The total of the unused and the used sponges must correspond to the number of sponges originally laid out prior to surgery. Looking back and evaluating, counting is the legal responsibility of the surgery team. Each institution must develop a policy and procedure for such counts and should include the discrepancy of materials counted, intervals of the counts, and documentation of the counted status on the intraoperative record. The responsibility for accurate sponge counts rests on the circulating nurse and scrub nurses. In conclusion, the operating room nurses are charged with the responsibility to ensure that no foreign objects remain in the body at conclusion of surgery. There is little insignificance to the fact that objects left inside patients' bodies can have catastrophic effects. Thank you very much.